Diabetes in the Hispanic juvenile population in the United States. Hispanics are nearly 2 times as likely to have diabetes as non-Hispanic whites in the United States. In general, this population experiences a disproportionate rate of obesity, lower levels of physical activity, higher cholesterol levels, poor eating habits, gestational diabetes, and a family history of diabetes. The purpose of this PowerPoint is to give an overview about the concerns of juvenile diabetes within the Hispanic population in the United States. There are significant factors that contribute to diabetes in Hispanic juveniles. These include a family history of diabetes, poor diet, lack of exercise, lack of education, and lack of access to health care. Many Hispanic families immigrate to the United States and have no health insurance and are paid low wages, which prevents them from obtaining proper medical care. Studies have shown that the Latino population has certain genes that have mutated over thousands of years. These mutations in the gene pool increases a person's risk of getting type 2 diabetes. About half of the Latinos carry the disease mutation. There is no doubt that the United States is facing a significant problem with the increase in juvenile diabetes in the Hispanic population. One of the greatest factors influencing the increase in juvenile diabetes is diet. It is very important that the Hispanic children exercise every day. Exercise helps to keep weight under control and to keep blood glucose levels at safe levels. Education is extremely important. This responsibility falls primarily on the parents, which can be problematic since language can be a barrier. Fortunately, there are many websites written for people that speak Spanish. The American Diabetes Association has a great website that is also printed in Spanish. The children of women that have type 2 diabetes during pregnancy are at a much greater risk of developing diabetes themselves. Symptoms of diabetes include increased thirst, frequent or nighttime urination, blurry vision, unusual fatigue, and increased hunger. Diet and exercise are extremely important in preventing diabetes in the juvenile. It's best to follow the food pyramid. As we talked about before, the American Diabetes Association has a great website. It has a virtual grocery store where they can get recipes. It's important to drink plenty of water, eat fruits and vegetables, eat healthy snacks, limit fast food, choose salads and meats that are grilled or broiled. It is important as healthcare professionals that we are aware of the issues of juvenile diabetes in Hispanic children. We as nurses are an important source of helping the families and in particular their children to reduce their risk of developing diabetes.